A reason treatment coordinators are struggling right now isn't because they've lost their skills. It's because the game they're being asked to play has fundamentally changed. And most practices are still using rules that no longer apply. Patients are more price sensitive than ever. We're seeing patients actively delay care, not because they don't value their health, but because dentistry has quietly slipped into the category of discretionary spending. When well over half of Americans report delaying dental treatment to cover basic household expenses, that's not resistance, that's financial anxiety. And all of this makes treatment acceptance, especially for complex care, far more challenging. Now, here's the paradox confusing a lot of dentists. Consumer spending on dentistry is technically up, yet more dentists than ever are saying, well, they're not busy enough. Wait times are at a 3-year low. Chairs are open. Capacity exists. But they're hesitating. That tells me the issue isn't demand, it's confidence. Patients are uncertain, they're cautious and overwhelmed well before they even sit into your operatory. Then we layer insurance on top of all of that. This is where treatment coordinators feel like they're in unwinnable battle. Insurance companies have quietly changed their tactics. Claims are being denied at higher rates. AI-driven claim reviews are scanning clinical notes for missing language. Reimbursements haven't kept pace with rising costs. Eligibility changes mid-treatment. Coverage disappears without warning. And somehow, the treatment coordinator is expected to stand in front of the patient and make all of that feel simple, predictable, and fair. That's not a sales problem. That's a structural one. When a treatment coordinator says, well, it really depends on your insurance, patients no longer hear honesty. They no longer hear clarity. They hear uncertainty. Not because the coordinator lacks competence, but because patients have been trained by retail experiences to expect instant, exact answers. Amazon doesn't say, well, it depends. Uber doesn't say, well, we'll know later. And insurance never has worked that way, but patients don't care. They're exhausted by complexity. Stop asking treatment coordinators to win a game that can't be won with charm, persuasion, and better scripting. This is no longer about selling dentistry. It's about designing financial clarity in a broken system. The role has shifted from sales to financial architecture. That means leadership has to change how the practice supports the conversation. Eligibility needs to move upstream, verifying insurance 48 hours before the appointment. This isn't a luxury anymore. It's a leadership responsibility. Accuracy protects trust. Surprises destroy it. It means acknowledging out loud that insurance is a contribution, not a solution. Patients need advocates who explain this process, not apologists who defend it. And yes, that means some practices will need to rethink their relationship with insurance altogether. Membership plans, they're not a marketing gimmick. They're a response to a system that no longer serves patients or teams well. They remove the middleman. They restore predictability and lower emotional friction. That's not about avoiding insurance, it's about protecting relationships. And AI, when used correctly, shouldn't be talking to patients into treatment. It should be helping teams anticipate problems before they happen, predicting likely claim denials, flagging downgrade risks, giving treatment coordinators the information they need to lead the conversation honestly and not react defensively. Now, here's what I don't want you to do. Don't pressure patients harder. Don't blame coordinators for low acceptance. And don't confuse transparency with certainty. You cannot promise what insurance will do, but you can promise leadership. Patients aren't saying no because dentistry is invaluable. They're saying no because the financial path feels unpredictable and emotionally unsafe. When you redesign the system to reduce uncertainty, acceptance naturally follows. So if your treatment coordinators feel like they're battling every day, well, listen to them. They're not asking for better scripts. They're asking for better structure. This isn't about motivation. It's about modernization done with integrity. The practices that will thrive aren't the ones that outsell the economy or outsmart the insurance. They're the ones that lead patients through reality with clarity and confidence. And when patients feel guided instead of cornered, even in a tough economy, it becomes easier to say yes. Thanks for listening.